Because life has no reset button, think safety.
When planning for a pandemic or any emergency that would affect the healthcare system, the number one issue is surge and surge capacity. And not just the surge capacity at hospitals, because they can only admit a certain amount of patients at a time, but if you have an overwhelming flow of people coming in, they're going to get backed up. That can typically happen on a Friday or Saturday night at any hospital in an emergency department, but you can also have a surge at doctors' offices because they can only see a finite number of patients. And if you have a lot of sick patients calling or coming in, you've got to find a way to open up the gates so that more people can be seen. Right. So, for instance, with pandemic influenza planning, surge capacity needs to be addressed. Well, you need to define what surge is, and the California Department of Health Services is starting a very unique project with PricewaterhouseCoopers to evaluate what is surge and develop standards and guidelines of what you can do in a surge. For instance, if you relax patient to nurse ratios, which would be done by the state health department because they license nurses, what impact would that have as a liability issue? Because now you don't have the same standard of care you had before. So what they want to do is develop guidelines in a surge, define maybe what would be relaxed and address the liability issues, as well as give hospital toolkits and checklists on how they can do that. So also one of the things that they want you to do is in the event that there's so many people coming into the hospital that you can't care for them immediately or see them, how do you develop an alternate care site? Exactly what is an alternate care site? Does it involve triage and then funneling them somewhere else? Do you keep them on the hospital grounds, on the parking lot? Do you have the ability to do that? I mean, no one knows. I mean, there are a lot of hard questions that need to be asked, before an emergency happens. Right. An all-hazards approach would encompass any emergency. Pandemic planning is unique in that it would be a sustained response where you wouldn't get any outside help. But with an all-hazards approach, you look at, say, if there's an earthquake, what would you do in an earthquake? You might be lucky in that situation in that you could have outside resources come in and help you. But with a pandemic, no one will be there. So with an all-hazards plan, you have to look at every kind of possible disaster situation, and some of that would have a basic component of emergency response that might be applicable in anything. Some things need to be fine-tuned. For instance, in a pandemic where you need a sustained response and no outside help. It was a pandemic influenza survey, just asking some basic questions as well as some more specific questions. Asking if they knew what pandemic influenza was. The majority of people didn't know what it was, or they had heard of it, but they really didn't know what it was. And then asking things like, would you be able to keep children home for 3 months if schools were closed? And a surprising finding to us in Los Angeles was that most people answered that yes, that they could do that. We find that an intriguing question because we think there'd be a lot of difficulties with that. If you keep children home for 3 months, that means someone needs to be home with them because this was a population defined as from 5 years of age to 17 years of age. And if you're going to have someone home for 3 months, they're going to need childcare. So do they have another family member available to do that? There's a lot of complications with that, as well as school meal programs. There are a lot of people in Los Angeles that depend on those meals for nutrition. We'd like to do an independent survey in Los Angeles and see how that Harvard survey would translate to us individually in Los Angeles County.